Welcome to this series on patient education, Learning to Live with Diabetes. What is diabetes? Diabetes is one of the oldest known diseases to man. What is diabetes? Diabetes is a disease that has been known to man since thousands of years. Although the most recognizable symptom of this disease is increase in blood glucose, in actual facts, it affects almost all organs of the body, including the heart, the kidneys, the eyes, and the peripheral nerves. The pancreas is the first organ to get involved in diabetes. Pancreas is situated in the abdomen behind the stomach near the duodenum. Pancreas contains these cells called as the islets of Langerhans. And these are the cells that produce the hormones which control blood glucose. What is the function of pancreas? Pancreas is concerned with the digestion of food which we eat. For the digestion of food, it secretes several enzymes, namely trypsin, lipase, and amylase. And these help in digestion of proteins, fats, and blood sugar. It also secretes very important hormones, that is insulin and glucagon. Whenever we eat any food which contains polysaccharides, these get broken down with the action of amylase into glucose, and the glucose will get absorbed in the blood. As the level of blood glucose in the blood starts increasing, the pancreas will secrete insulin. The job of insulin is to convert this blood glucose into glucagon, which is stored in the liver. During the period in which we are not actively eating, that is, during the period between lunch and dinner, when we do not consume glucose, the blood sugar has to be maintained so that the body can make use of this blood glucose. This function is done by glucagon. So during the period where we do not actively eat glucose, glucagon releases blood sugar from the glycogen which is stored in the liver. So what is the function of insulin? Insulin is required by every cell in the body, including the brain, the red blood cells, and the heart. It is required for the entry of glucose into the cell. In the absence of insulin, the cell will not be able to consume glucose and will have to rely on fats and proteins as a primary source of energy. In the absence of insulin, we have what is called a starvation in the middle of plenty. So although a diabetic patient may have lot of glucose in his blood, because of the absence of insulin, the cells are not able to utilize this glucose. And that is why a diabetic patient craves for sugar containing food, although his blood sugar is full of it. How does diabetes develop? The commonest form of diabetes, which is insulin dependent diabetes mellitus, is a familial disease. So most patients give a family history of diabetes. At a young age, everything is fine. However, at the age of 20 or 30 or 40, the patient starts putting on weight. Most diabetic patients, at least 10 to 20%, they weigh 10 to 20% more than their ideal weight for their height. As time progresses, because of this increase in weight, the insulin that is produced by the pancreas is not sufficient for the body, and this results in increase in blood glucose levels, which is called as hyperglycemia. The kidneys function to clean the blood and and produce urine. During this process of filtering of the blood glucose is conserved and it is not allowed to pass in the urine. However, a limit is there at to which the glucose in the blood can be controlled by the kidney. And when this limit is breached, blood glucose from the blood starts appearing in the urine, and then we get a symptom where we have glycosuria, that is presence of glucose in the urine. As we all know, glucose is an osmotically active substance, and as glucose starts getting excreted in the urine, it will pull water along with it, producing polyuria. So patients of diabetes are usually more in weight compared to their peers for their height. They produce insulin which is not sufficient for the body, resulting in hyperglycemia, polyuria, and because of the increase of water loss, they also have increased thirst. These patients typically present with delayed wound healing. So if a patient gets hurt, it is not uncommon to tell us that the wound healing takes time. So then we come to what is called as adult onset diabetes. This is also called as non-insulin dependent diabetes. As previously discussed, usually presents in adult life, hereditary. There is no particular gene or gene sequence which has been identified which can tell us whether a particular person has inherited the disease from his parents or not. The patient produces insulin which is in insufficient quantities for his body's needs, and insulin resistance is a prominent feature of the disease. What I mean by insulin resistance is that the amount of insulin produced is usually high, but in spite of that, the body is not able to function and the body is not able to make use of the insulin that is present. This is because the decrease in number of receptors of insulin on cells. So then we come to the types of diabetes. There are basically two types. The non-insulin dependent diabetes mellitus is as discussed is a hereditary disease, and these patients can usually be treated by oral anti-diabetic agents. Against this, insulin dependent diabetes mellitus can happen anytime in life. It is usually not hereditary. However, a genetic predisposition is present, and in these patients, the pancreatic cells that produce insulin are totally destroyed. Because of this, the patient becomes totally dependent on insulin, and these patients cannot be treated by oral anti-diabetic agents. They have to take insulin for life. Why is the incidence of diabetes increasing? This is because of several factors. Number one, longevity. People live much longer than they lived 50 years back. This is because of excellent medical facilities that we all have. Second, sedentary lifestyle. The amount of physical activity that we do when we live in cities is just not enough. Changing food habits. We tend to eat a lot of junk food which is rich in calories. This increases weight, and whenever the weight increases, it is associated with increase in insulin resistance producing diabetes. Urban stress. So in all these factors put together, we are facing an obesity epidemic, and that is the reason why diabetes is common. Let us look at common questions that are put up to me. A 35-year-old male working in a bank will ask, my mother is a diabetic. Will I develop diabetes? Diabetes is multifactorial. The possibility of development of diabetes is high if your parents have diabetes, although this is not always true. We can have children or patients who give history of family history but do not necessarily develop diabetes. The predisposing factors for development of diabetes is obesity and lack of exercise. So if you have a strong family history of diabetes and if you don't want to develop diabetes, then you have to take care of these two factors. So if you're able to maintain your weight and if you do a lot of exercise, it is possible that you can delay the onset of diabetes. Another common question that is asked is a non-diabetic individual will ask, I have a family history of diabetes. How often should I check my blood to see if I'm developing diabetes? The answer is at least once in 3 years before the age of 40 and once every year after the age of 40. However, the frequency can be increased if symptoms that are common to diabetes appear. Question number 3. My relative has a glucometer. Can I check my level there to see if I'm a diabetic? Current technology that is used in glucometers is not good enough for the diagnosis of diabetes. This is especially true when you are a borderline diabetic. If you are a frank diabetic where the blood sugar is more than 200, then the glucometer may be able to help you. But those diabetics who are on the border or who are just above normal will not get diagnosed correctly with the help of glucometers. Which are the organs that are affected in diabetes? The cardiovascular system, including the heart, is affected. Diabetes is a risk factor for coronary artery disease, which can produce heart attacks. The diabetes involves the small vessels of the retina, that is the eyes, and most diabetic patients will have some amount of diabetic retinopathy, due to which the vision quality is decreased. The capillaries in the kidneys are also involved, and this produces diabetic nephropathy. What are the diseases that get aggravated in diabetics? There is prolonged time for healing. Because of increase in blood sugar levels, patients who have injuries are more prone for infection. As we all know, bacteria can thrive in the presence of high blood glucose level. So any injury in a diabetic patient, the risk of infection always increase. What also happens is that the WBCs or the white blood cells, which are responsible for combating these infections, do not function as well as in non-diabetics. The killing facilities of these WBCs is decreased in diabetic patients. This results in repeated infections, and infections can be more dangerous in diabetic than in non-diabetic patients. The most common infections that diabetics suffer from are urinary tract infection, lung infection, bacterial infection, and fungal infection. One also has to keep in mind that in the presence of infection, the requirement of insulin goes up. And that is why patients who are otherwise under good control may go out of control, or the glucose temporarily may be increased in the presence of infection. What are the investigations in diabetes? For the diagnosis of diabetes, we use two tests, that is fasting and post glucose blood glucose measurement. For the control of diabetes, we use fasting and post lunch. We use glycosylated hemoglobin, microalbumin, serum creatinine, serum lipids, and EGFR.